Hello everyone, I am very happy to meet you again and have a chance to make a presentation. This is my disclosure. Today I'll show the three parts like this. First is lesson from the bench study and pathology. This is a bench study in the left main bifurcation model. If we implant 3.0 mm stent according to the distal diameter and do not perform POT or KVI, the outer region where the stent strut that is surrounded by a yellow circle cause incomplete apposition, it can be seen that the blood flow dropped extremely. Furthermore, on the gelled circumflex ostium, it is easy to see that the blood turbulence and drop are occurring on the back of the strut. If we choose a 4.0 mm stent according to the diameter of the proximal side and do neither POT nor KBI, the area of incomplete apposition of the stent will decrease and the blood flow reduction area will also decrease. On the other hand, in gelled circumflex ostium, it is easy to see that turbulent flow and decrease of blood are occurring on the back of the strut as in the previous result. Let's all think, what do the result of this bench study mean? The pathological findings reported by Dr. Mori and Professor Birmani in 2018 showed us a very impressive answer. Thrombosis in stent implanted left main shaft and left main bifurcation are extremely infrequent. However, once they occur, they can be fatal. It shows that this thrombosis can occur for a long time after treatment, regardless of the version of DES, and that their main cause is stent incomplete apposition on the left main shaft or gelled side branch ostium. Again, even with the frequency of stent thrombosis in left main is low, once it occurs, it is directly linked to the sudden death of the patient. Therefore, it must be avoided as much as possible when using a stent. This fluid visualization test showed that there is a marked slow flow between the vessel wall and the incomplete stent apposition area, and turbulence and slow flow always appear on the back of the gelled strut at the side branch ostium. So we come up with some requirement. Eliminate incomplete apposition of stent. Reduce the deformation of the stent on the main vessel side. And reduce gelled strut at the side branch ostium. Therefore, we compare the incomplete apposition volume of the Culotte and decay crush method, which are also used in the two-stent technique. On the left is a flow chart of the Culotte procedure. On the right is a flow chart of the decay crush. For the same left main bifurcation model, Culotte stent and decay crush stent were performed 6 times under the fluoroscopic situation using synergy. The left is Culotte and the right is the whole image of the decay crush. The part of Carina painted in green shows the incomplete apposition. The area of the blue is the incomplete apposition of the left main shaft. In the Culotte group, the green triangle shows the incomplete apposition volume in the carried part of each model. The decay group, there is a considerable variation in the result. Compare the Culotte stent group. DK crush group were higher in all incomplete stent apposition volume in the lateral wall and carina. Next, the effect of the difference in pressure on the stent apposition was evaluated. In the high-pressure DK group, there was considerable variation in the result too. From these results, consider how to get better result. Here is a result of comparing the three groups. The stent incomplete apposition volume on the lateral wall can be reduced by changing the pressure at the time of crush or final KBI. It is recommended to reduce the area of strut triple as much as possible. Consideration should also be given to the stent design. Choosing high pressure indicates tend to reduce the stent incomplete apposition volume in carina. As another important factor, the guide wire recrossing point is greatly involved, which is still an unsolved problem. My conclusion: stent thrombosis in left main is directly linked to patient death and is an event that we want to eliminate as much as possible. The key point are stent incomplete apposition at the left main shaft and jailed strut at the side branch ostium. Each stent implantation method has advantage and disadvantage, and there are still many points that need to be improved. In particular, the recrossing point of guide wire is very important. However, it is not completely controlled, and it is one of the remaining important issues. Thank you very much.